My presentation is on infectious diseases. These will include MRSA, coccidiomycosis, Lyme disease, and influenza. Aureus is an antimicrobial resistant type of Staph aureus that is resistant to currently available beta-lactam antibiotics, including penicillins, the anti-staphylococcal penicillins, and cephalosporins. So where is MRSA found? Outside of the healthcare settings, it's found in the community where you live, work, shop, and go to school. The risk increases with activities or places that involve crowding, skin-to-skin contact, and shared equipment or supplies. Athletes, daycare and school students, and military personnel in the barracks are especially susceptible because of the close contact that they have with each other. In the healthcare setting, the hospital and nursing home is a setting that MRSA is often seen in. Approximately 5% of patients in the U.S. hospitals carry MRSA in their nose or on their skin. So how is MRSA spread in the community? It's usually spread in the community by contact with infected people or things that are carrying the bacteria. Contact with a contaminated wound, sharing personal items that have touched infected skin, such as towels or razors, is another way of spreading the MRSA. And also, the opioid epidemic has also shown an increase in MRSA infection, with people who inject drugs are actually 16 times more likely to develop a serious staph infection. The symptoms of MRSA are a red, swollen, painful, warm to the touch, full of pus or other drainage, often accompanied by a fever, and people will often confuse the boil or whatever it may be as confused with a spider bite, that's what they present with, is that they think they got a spider bite. This is a picture of one of my colleagues' son who developed the red, swollen, painful, she thought it was a bite on his lower abdomen, and when she took him in, it turned out that it was MRSA. And this is another one that it looks like it could be a bite, but it is in fact also MRSA. So what's the treatment? The first treatment, primary therapy, is an incision and drainage for the purulent skin infections. And then empiric antimicrobial coverage for MRSA may also be warranted, in addition to the IND based on clinical assessment, and which would include severe local symptoms or systemic symptoms, or someone that is immunosuppressed, extremes of patient age, which would be obviously somebody who's very young or very old, or with an infection in a difficult to drain area, such as a groin, or if they've not responded to the incision and drainage alone. Also, obtaining specimens for culture and susceptibility testing is useful to guide therapy, particularly for those who fail to respond to initial management. The antibiotics of choice for MRSA are clindamycin and tetracyclines. The clindamycin, the only precaution with that is C. diff infection. While it's uncommon, it may occur more frequently in association with clindamycin compared to other agents. The tetracyclines, doxycycline is the preferred drug. The precautions with that is that it's not recommended during pregnancy. It's not recommended for children under age 8, and the activity against group A streptococcus, a common cause of cellulitis, is unknown. MRSA is resistant to all currently available beta-lactam agents, penicillins and cephalosporins. The fluoroquinolones and macrolides are not optimal treatment for MRSA, soft skin tissue infections, because resistance is common or may develop rapidly. The most important critical component of MRSA case management is patient education, and maintaining good hand and body hygiene, keeping cuts, scrapes, and wounds clean and covered until healed, avoiding sharing personal items such as towels and razors, and not picking at or trying to pop a sore if there is one there, and being sure to shower immediately after activities where you have direct skin contact with people or shared services or equipment, such as exercising at a health club. Coccidioides. It's also sometimes called San Joaquin Valley fever or desert rheumatism. It usually refers to an infection in the lungs, but the infection can spread to other parts of the body in severe cases, which is called disseminated coccidiomycosis. The fungus is known to live in the soil in the southwestern U.S. and parts of Mexico and Central and South America. People can get valley fever by breathing in the microscopic fungal spores from the air in these areas. Lungs, the person's body temperature allows the spores to change shape and grow into spherules. When the spherules get large enough, they break open and release smaller pieces called endospores, which can then potentially spread within the lungs or to other organs and grow into new spherules. So who gets valley fever? It's most common in adults age 60 and older, although certain groups of people are at a higher risk for developing the severe forms of valley fever, such as those who have weakened immune system due to HIV, pregnant women, people who have diabetes, and people who are Black or Filipino. Some facts on valley fever. Most people who breathe in the sores don't get sick. Usually people who get sick with valley fever will get better on their own within weeks to months. Valley fever is not contagious between people or between people and animals. If you have had valley fever, your immune system will most likely protect you from getting it again. Pets, particularly dogs, can get valley fever, but it is not contagious, like I said, between animals and people. Symptoms of valley fever: fatigue, cough, fever, shortness of breath, headache, night sweats, muscle aches or joint pain, and rash on the upper body or legs. Symptoms of valley fever may appear between 1 and 3 weeks after a person breathes in the fungal spores. Diagnosis and treatment for valley fever. Most common way to diagnose valley fever is sending a blood sample to look for the coccidiioides antibodies or antigens, and that's with the IgM and IgG. You can also use a chest x-ray or CT of the chest, or a tissue or fluid biopsy. Antifungal medication is typically given to people who are at a higher risk for developing severe valley fever. And the treatment of choice is fluconazole, and it's usually for 3 to 6 months. Patient education. Try to avoid areas with a lot of dust. Stay inside during dust storms and close your windows. Avoid activities that involve close contact to dirt or dust, including yard work, gardening, and digging. Use an air filtration measures indoors, and clean skin injuries well with soap and water to reduce the chance of developing a skin infection, especially if the wound was exposed to dirt or dust. Of an infected tick. Bacteria that can cause Lyme disease is Borrelia burgdorferi. That's seen in North America and Europe. The other two, the B. afzelii and the B. gargarini, are only seen in Europe and Asia, and they have recently found another one, the Borrelia mayoni, which is found in North America and the upper Midwest. Each year, approximately 30,000 cases of Lyme disease are reported to the CDC by state health departments. The early signs and symptoms of Lyme disease, which is 3 to 30 days after the tick bite, includes a red rash, which may look like a bullseye, but not all people with Lyme disease have the rash. Other symptoms are a fever, a headache, a stiff neck, body aches, and fatigue. Some of the later signs and symptoms, which can occur days to months after the tick bite, is a severe headache and neck stiffness, facial palsy, arthritis with severe joint and swelling, pain, particularly the knees and other large joints, intermittent pain in tendons, muscles, joints, and bones, heart palpitations or an irregular heartbeat, which is called Lyme carditis, inflammation of the brain and spinal cord, nerve pain, shooting pains, numbness, or tingling in the hands or feet. Diagnosis and testing. When assessing a patient for Lyme disease, healthcare providers should consider the signs and symptoms of Lyme disease, the likelihood that the patient has been exposed to infected black-legged ticks, the possibility that other illnesses may cause similar symptoms, and results of laboratory tests. There is a 2-tiered testing for Lyme disease. The CDC currently recommends this testing process. Both steps are required and can be done using the blood samples. If the first step is negative, then no further testing is recommended. If the first step is positive or indeterminate, the second step should be performed. The overall result is positive only when the first test is positive or equivocal and the second test is positive, or for some tests, equivocal. So this chart shows the two tests, the first test and the second test. If that first test is negative, then they recommend considering an alternative diagnosis. The treatment for diagnosed Lyme disease in adults and children is both the amoxicillin and doxycycline and the cefuroxime axetil, and this is the dosaging chart here. For people intolerant of amoxicillin, the doxycycline, and the cefuroxime, the macrolides, azithromycin, chlorothromycin, or erythromycin may be used, although they have a lower efficacy, and people treated with the macrolides should be closely monitored to ensure that symptoms do resolve. Patient education. Reducing exposure to ticks is the best defense against Lyme disease. Tick exposure can occur year-round, but ticks are most active during warmer months, April to September usually. Treat clothing and gear with products containing permethrin. Permethrin can be used to treat boots, clothing, and camping gear and remain protective through several washings. Alternatively, you can buy permethrin-treated clothing and gear. And know where to expect ticks. Ticks live in grassy, brushy, or wooded areas, or even on animals. Spending time outside walking your dog, camping, gardening, or hunting could bring you in close contact with ticks. Many people get ticks in their own yard or neighborhood. Use EPA-registered insect repellent containing DEET. Check your body for ticks after being outdoors. A full body check after you come back inside, including under your arms, around your ears, belly buttons, back of the knees, in and around the hair, between the legs, and around the waist. And of course, make sure to check your child's body also if they were out. Of influenza virus, and that's type A and B. The viruses routinely spread in people and are responsible for seasonal flu epidemics each year. The influenza A viruses can be broken down into subtypes depending on the genes that make up the surface proteins. Over the course of a flu season, different types A and B and subtypes of influenza circulate and cause illness. The graphic shows the two types of influenza viruses, A and B, that cause most human illnesses and that are responsible for the flu season. Influenza A viruses are further classified into subtypes, while influenza B are further classified into two lineages. Both of them can be further classified into specific clades and subclades, which are sometimes called groups and subgroups. Symptoms of the flu include fever or feeling feverish and chills, although not everyone has the flu has fever, a cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and some people may have vomiting and diarrhea, though that's more common in children than adults. Some information regarding the flu. Most experts believe that the flu virus is spread mainly by tiny droplets made when people with flu cough, sneeze, or talk. Less often, flu can be spread by touching a surface or object that has the flu virus on it. People age 65 and older, pregnant women, children younger than 5, and people with certain chronic medical conditions are at a higher risk from the flu. People with the flu are most contagious in the first 3 to 4 days after their illness begins. Some otherwise healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. Some people, especially young children and people with weakened immune systems, might be able to infect others for an even longer period of time. Complications of flu can include bacterial pneumonia, ear infections, sinus infections, and worsening of chronic medical conditions. Diagnosis and treatment of the flu. It can be difficult to distinguish the flu from other viral or bacterial illnesses based on symptoms alone. The lab tests are available to diagnose influenza A and or B, and it can usually be done in the office, at the clinic, or sent over to the lab. Most people with the flu have mild illness and don't need any medical care or antiviral drugs. Antiviral drugs are used to treat flu for high-risk groups or those who are very sick. Antiviral drugs can make illness milder and shorten the time you are sick. They can also prevent serious flu complications. However, the antivirals do have some severe side effects, so that definitely needs to be weighed against the benefits. Studies show that antivirals work best when started within 2 days of onset of symptoms. Patient education.